Hi, my name is Samuel Park, and I'm here to discuss muscle recruitment in wrist extensors and flexors during different types of contraction. This is important because we use these muscles in our daily lives through tasks such as picking up our backpacks off the ground, and they're involved in a wide range of injuries and pathologies, from ones as mild as writer's cramp to pathologies more serious such as cerebral palsy and Huntington's disease. In our investigation, we looked at three types of contraction, namely isometric, concentric, and eccentric contractions. We hypothesized that our wrist extensors would experience greater muscle recruitment when we were going through wrist extension, both concentrically and eccentrically, while our wrist flexors would experience greater muscle recruitment during eccentric and concentric wrist flexion. Now, our subjects were taken from Regis University in our DPT cohort of the class of 2021. We chose 8 subjects with a mean age of 25.1 years of age and a standard deviation of 3.0 years. We needed our patients to be able to perform pain-free wrist extension and flexion throughout the full range of motion, and we needed them to be willing to have their arm hair shaved, particularly in the regions where the muscle bellies were. Now, our subjects were seated and had their testing arm on a table, resting such that their elbow was flexed at 90 degrees. And for all of our conditions, we used the same hand weight except for a maximal voluntary contraction, where we used manual resistance. The mean and standard deviation values were calculated from our 8 subjects, and an ANOVA test was conducted using all 8 conditions. We found that there was a significant statistical difference across all 8 conditions when they were all combined. Now, we are not able to discern which of these conditions were statistically significantly different from one another, as that will require specific t-tests across 2 of the conditions. However, our results at the very least did not contradict the existing literature. For example, the one that studies patients with cerebral palsy that demonstrated or concluded that EMG recordings successfully analyzed motor unit activation in these affected populations. Now, if these findings are clinically relevant, we will be able to tailor our training plans for our patients in a way that would suit them more and be able to potentially extrapolate these findings to other patient populations as well, making the data more versatile. Thank you very much.